Hello and welcome to the video. Today we are going to talk about infant and maternal health. We will cover various topics about this subject. The goal of this video is to give you a basic understanding of infant and maternal health. Also, we aim to enhance your knowledge about infant and maternal health. Feel free to share this video with someone you feel may need this information. And as always, if you have any further questions, comments, and/or concerns about you and your baby's health, contact your healthcare provider. Your healthcare provider is and will remain the best source for you to obtain health information. Every pregnancy is unique. Your pregnancy might not be the same as your first, but your healthcare provider will be able to provide you with information to ensure your current and future pregnancies go smoothly. Now, let's get on with the video. So, what is maternal and infant health about? Maternal and infant health refers to the health of women during pregnancy, childbirth, and the postpartum period, as well as the health of infants from birth through their first year of life. This field encompasses a wide range of topics, including prenatal care, maternal health, infant health, nutrition, mental health, education and support, access to care, and public health initiatives. Ultimately, effective maternal and infant health care aims to ensure that both mothers and infants receive the care and support they need for a healthy pregnancy, childbirth, and early childhood. Now, let's dive into the previously mentioned topics a little deeper. Prenatal care is regular medical and nursing care for women during pregnancy to monitor the health of both the mother and the developing fetus. Maternal health centers on the health of women during pregnancy, childbirth, and the postpartum period, addressing issues like maternal mortality, preeclampsia, gestational diabetes, and other pregnancy-related conditions. Infant health involves the health and well-being of newborns and infants up to 1 year old, focusing on issues such as infant mortality, birth defects, prematurity, breastfeeding, and immunizations. Nutrition is about ensuring proper nutrition for both the mother during pregnancy and the infant after birth to support healthy development. Mental health. Addressing mental health issues that may arise during pregnancy and after childbirth, including postpartum depression. Also, providing education to expectant and new mothers about healthy practices, breastfeeding, and infant care, as well as offering emotional and social support. Lastly, ensuring that all women and infants have access to the necessary healthcare services, regardless of socioeconomic status. Let's cover health equity. Health equity refers to the principle of and commitment to eliminating disparities in health and healthcare access and outcomes that are systematically associated with social, economic, demographic, or geographic disadvantages. It involves creating opportunities for all individuals to achieve their full health potential, regardless of their race, ethnicity, gender, income, education level, or geographic location. Health equity ensures that everyone has a fair and just opportunity to be as healthy as possible. In many cases, African American women are more impacted by health disparities than any other racial group. African American women are more likely to die from pregnancy-related complications than women of other races. This disparity is often attributed to a combination of factors, including lack of access to quality health care, implicit bias within the healthcare system, and underlying health conditions that are more prevalent in African American communities. African American women have higher rates of preterm birth and infants born with low birth weight. These conditions can lead to long-term health problems for the infant. Stress, lack of access to prenatal care, and socioeconomic factors contribute to these higher rates. African American women are more likely to suffer from chronic health conditions such as hypertension, diabetes, and obesity, which can complicate pregnancy and childbirth. Lastly, implicit bias and discrimination within the healthcare system can lead to African American women receiving lower quality care, not being listened to by healthcare providers, and having their concerns dismissed, all of which can contribute to poorer health outcomes. Now, let's talk about some ways healthcare providers in partnership with new and previous mothers to achieve long-term positive developmental outcomes. Achieving long-term positive health outcomes for maternal and infant health requires a comprehensive approach that addresses both medical and socioeconomic factors. Here are several strategies to ensure healthier futures for mothers and infants. Regular and early prenatal visits to monitor the health of both mother and baby. This helps in early detection and management of potential complications. Continued care after childbirth to monitor the mother's and baby's health, providing support for breastfeeding and addressing postpartum depression. Education is important as well. Educating women about healthy practices during pregnancy, childbirth, and postpartum, including nutrition, exercise, and recognizing warning signs of complications. And providing support for low-income families to access healthcare, nutritious food, and safe housing. Lastly, training healthcare providers to deliver care that is respectful of and responsive to the cultural and linguistic needs of diverse patients. Implementing training programs to reduce implicit bias in healthcare settings and improve patient-provider communication. And developing programs specifically designed to address the unique needs of high-risk populations, such as African American women, to reduce disparities in health outcomes. As this video draws to a close, it's important to remember a few things about maternal and infant health. First, maternal and infant health is a broad topic that includes many different areas of health and wellness for the mother and baby. In general, maternal and infant health is about medical and non-medical care aimed at women before, during, and after pregnancy. This also involves care directed to the infant up until they reach a year in age. Secondly, it's important for pregnant women to understand nutrition, adequate sleep, doctor's appointments, and many other aspects of maternal and infant health can all contribute to a safe and healthy pregnancy. Lastly, African American women may experience issues in achieving health equity. Black women and their babies often are at the receiving end of negative health outcomes as a result of the social determinants of health and implicit bias in the medical industry. It's important for Black women to understand their vulnerability within the healthcare system and seek ways to avoid these pitfalls. That will conclude the video. Thanks for joining us today. Please continue to support the channel and hit the subscribe button and notification bell. Feel free to share your thoughts and comments below. We look forward to seeing you in the next video. Until then, see you soon.